Welcome to our guide on understanding and treating elevated blood pressure, focusing specifically on the UK's National Institute for Health and Care Excellence, or NICE, guidelines. Elevated blood pressure is a common condition, but understanding how it's defined, monitored, and treated according to national standards is essential for effective management. Elevated blood pressure, or hypertension, is defined as a sustained increase in the pressure exerted by the blood against the walls of the arteries. Uncontrolled high blood pressure is a major risk factor for serious health issues, including heart attack, stroke, and kidney disease. Early diagnosis and management are crucial. Let's look at the NICE guidelines for diagnosing and monitoring blood pressure to ensure accurate assessment. Blood pressure should be measured either in the clinic or, preferably, using automated ambulatory or home blood pressure monitoring for accurate diagnosis and to reduce the white coat effect. NICE defines hypertension based on specific thresholds. A sustained clinic reading of over 140/90 or ambulatory and home averages over 135/85 generally warrants further action. After diagnosis, regular monitoring is essential. Patients should have an annual review, with the goal of achieving individual blood pressure targets within 3 months of starting or changing treatment. Before or alongside medication, simple changes to lifestyle can significantly lower blood pressure. A key recommendation is reducing dietary salt intake. High salt consumption raises blood pressure, so aim to stick to daily recommended limits. Regular physical activity, such as at least 150 minutes of moderate intensity exercise per week, is proven to help manage blood pressure. Smoking is a major risk factor for cardiovascular disease. Quitting, along with limiting alcohol consumption, provides immediate health benefits, including lower blood pressure. For many, lifestyle changes are not enough, and pharmacological treatment based on NICE's guidance becomes necessary. Drug treatment is usually started for patients with high risk, or those diagnosed with stage 2 hypertension. However, it's also considered for stage 1 if other cardiovascular risk factors are present. NICE advocates for a stepwise approach using a combination of drugs, commonly starting with an ACE inhibitor or calcium channel blocker, and adding a diuretic if needed. Treatment targets vary. For those under 80, the goal is typically below 140/90, while for those over 80, a slightly higher target is acceptable, with home blood pressure targets always lower. Managing elevated blood pressure is a long-term journey, requiring consistent effort and adherence to medical advice. Remember the key steps: accurate diagnosis, implementing healthy lifestyle changes, adhering to the prescribed drug regimen, and ensuring you meet your individual blood pressure targets. Regular follow-up with your healthcare provider is essential for monitoring progress, adjusting treatment, and ensuring long-term control of your blood pressure.